name is Katie Mitchell, and I want to thank Audrey for the opportunity to talk about physical therapy with you today. My background is that I have a bachelor's degree in biology from the University of California at Davis, which is in Northern California. I went up to a university called Pacific University, which is up by Portland, Oregon. I went to college there for 3 years to get my Master of Science in Physical Therapy. After working for a few years as a physical therapist, I decided I wanted to be in academia. And so my husband and I, back in 1999, we moved to Houston, where I joined Texas Women's University as both a staff person, but also I started my work on my PhD. And I finished my PhD in 2003, and my PhD is in physical therapy. And I decided to take a faculty position at that time, back in 2003, as an assistant professor. And then I worked my way up over the years, and now I'm a full professor in physical therapy at Texas Women's in Houston. And I'm also the associate director of the program. So first, the past 12 years, I've actually been overseeing the PhD program in physical therapy. And now I oversee the entry-level program and the PhD in Houston as the associate director. Over the years, I've taught a number of different courses. My main interests are in acute care. And so I have taught classes in internal medicine. I've also taught the course in integumentary medicine, which is, most people think of it as the wound care class for physical therapists. I also teach the research class to our entry-level students. And so I've taught a number of other classes over the years, but I currently also teach in the PhD program, and I am a statistician. So I really enjoy those classes, and I actually teach the statistics number 2 class for our PhD students, as well as their applied statistics class, which is kind of their kind of final qualifying exam in statistics. My next question is about why I chose physical therapy as a career. And it was actually quite a long time ago, so it's kind of hard for me to remember, but I definitely had a passion for science, and I loved my classes in high school in the STEM fields, especially biology. And so I went on to UC Davis and took classes in biology and knew I wanted to do something in the medical field. And I had a family friend who was a physical therapist, and the thing that really appealed to me was that you're getting to work with patients, that you're really getting to spend a lot of one-on-one time with them. A lot of other careers in medicine, you don't get to spend a whole lot of time with the patient, especially more and more with problems with cutting back on time with insurance. But physical therapists really get to spend that quality time, sometimes up to maybe an hour at a time, and really work with them to achieve whatever goals they're shooting for. You know, sometimes it's a person who wants to be able to walk again, or go home with a loved one, or maybe walk their daughter down the aisle for their wedding. So you really get to target something that's super meaningful for that person and kind of go on that journey with them and try to figure out the ways that you can work together to make that happen. And so that's why I really fell in love with this profession, and why I have stayed in the profession for, I think about 30 years. My next question was about what makes the career of physical therapy unique, or something that people don't know about that career. So I think the one thing I would want to say is that a lot of times people think of physical therapists as people that treat sports type injuries. And that's actually just a very small part of our profession. We have people that are working in neonatal intensive care units with very, very premature infants, all the way up to people that are very specialized in treating advanced geriatric care and memory care, and people in Alzheimer's units, or everything in between. So we treat the entire lifespan, and we treat everything from wounds to your typical sports kind of injuries, but also head injuries, patients who've had strokes, patients who've had spinal cord injuries, and obviously a whole wide range of surgery procedures. And so I just think that that's the one thing I think that I would love for more people to really understand, is how much variety there is in this profession. Okay, Okay, so the next question it gets a little more challenging for me. So the question is, what is your opinion about chiropractic techniques? So I think some people know that maybe they feel like chiropractic medicine and physical therapy are at odds. And I wouldn't necessarily say that. And I'm always foretelling patients that if it works for you and you feel better and you regain your function, I am for that. So whether that is all sorts of different types of intervention. I would say that there are certainly things that set physical therapy and chiropractic medicine apart. Some of that, it goes with our training. So you will see that physical therapy programs are housed at traditional universities, much like Texas Women's University has its own physical therapy school, where chiropractic programs are often housed at colleges of chiropractic medicine. So they typically do not have other programs besides chiropractic medicine, and they're not housed in your traditional universities. Another thing that sets it apart, I would say, is kind of the philosophy behind the treatments. So I guess what they share is that you might find, for example, both physical therapists and chiropractors doing manipulation of the spine. They're kind of cracking someone's back, for example. That is a very small part of what physical therapists do, and our philosophy is very much based on the idea that maybe you might have some joints that aren't moving quite enough, and so you might mobilize those joints or maybe even do a manipulation, but it's a one-time thing typically, and then you would continue to regain your function through exercise and movement, and it would be something that you would learn to take care of yourself moving forward. So if this happened to you again, then you would very much be able to handle this. And usually the visits are very few. Usually to a physical therapist for a typical injury, it's about 6 visits or so. Chiropractic medicine has much more of their foundation on manipulating joints. And oftentimes they do that more often than physical therapists. Physical therapists have the belief that if you do that too often, you could actually damage the joint. That is not as much of the case for chiropractic medicine typically. And also they tend to see their patients more frequently, and sometimes they'll have those patients come back for kind of repeated visits and things that we don't often do that in physical therapy. I have to start by saying many chiropractors feel very differently about this one topic, but one thing that you might see, and it's still very much the foundation of chiropractic medicine, is that mobilization or manipulation of joints can actually be used to address things like typical disease, such as maybe an autoimmune disorder or an infectious disease process. And physical therapists do not believe that there's any sort of connection between manipulating or mobilizing joints and fixing an infectious disease, for example. Chiropractors also don't do things like treat patients as often throughout the whole lifespan. You certainly see chiropractors out there treating children and manipulating their spines, but for the most, and geriatrics as well. But that whole wide gamut we talked about, from spinal cord injury and strokes and neurologic conditions like Guillain-Barré or MS or a whole host of things, you don't usually see that in chiropractic medicine. Another big difference is that you don't see chiropractors in what we would consider traditional medical fields of practice, for example. Chiropractors do not typically have privileges to work in hospitals, for example. That is something they often treat patients as an outpatient only, whereas physical therapists you might see in an ICU, an outpatient clinic, a nursing home, all sorts of different areas, as opposed to just kind of outpatient. Okay, so my opinion is, if it works for you, I think that's great. I would always ask somebody to look at the literature and kind of see the foundations of where these professions came from. I think in some ways there are some more overlaps than there used to be, but there are still a lot of big fundamental areas that we really, really differ on. So, okay, without getting into too much trouble, I think I'm going to stop it there. My next question was, do you think chiropractic techniques can lead to more injuries than physical therapy? And I guess the literature shows that yes, that is true. Chiropractors do tend to have more problems with getting sued from causing injuries. However, I would say it's very much in the nature of their practice. So they tend to do a lot more spinal mobilization and manipulations compared to all physical therapists, because we have physical therapists that are doing all sorts of different things. And I think the nature of working on the spine can lead to injury of the spinal cord. So obviously, an injury of the spinal cord is severe and can lead to lifelong disability. And so when they do tend to cause an injury, it can be really life-altering. And the literature does support that. So I would say yes, but I also want to just preface that by I think it's somewhat based on the type of treatments that they do. The last question was just anything else I wanted to share about being a PT. And, I just think it's a great field. I think that we certainly would love to see more of our TW undergrad come to us in our doctoral program. We love having TW undergrad students with us. We're really excited because if you didn't know, we are actually opening a third whole group of PT students are going to be starting to get trained in Denton. And so we're excited about that. The new building is being built over by the Pioneer Village dorms. And so we're really excited that instead of starting our cohorts with about 55 students in Dallas and Houston, we're going to be eventually adding another 55 students or so up in Denton. So hopefully, if you're interested in learning more, that you'll reach out to us at the School of Physical Therapy. Thanks so much.